How can I get rid of crepey under eyes? I had my upper and lower eyelids done last year, and my under eyes are so crepey. What can be done about that?
Thank you for your question. You're asking how you can get rid of crepey skin. And you state in your question that you had upper and lower eyelid surgery done last year, but you're concerned about the crepey quality of your skin. Well, certainly I can give you some guidance as to how I counsel my patients who I do blepharoplasty or eyelid surgery for. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years and providing comprehensive solutions for the eye area is a significant part of my practice. So I can walk you through my thought process and also where the decision points are. In addition, how I advise my patients about ongoing care. So to begin with, if someone comes into the office who has lighter skin and has this crepey skin quality, and typically it is a combination of aging changes and sun exposure with other factors such as smoking and environmental factors. So now the skin is very crepey. So if someone has bags under their eyes, very often the bags will push forward and almost camouflage the quality of the skin because it kind of stretches it out. So I will always counsel patients to anticipate that, so we can do things during surgery. So for a lighter skin patient, and understanding that the eyelid skin is 0.5 millimeter thickness, the question that comes to mind first is, how much can we do during surgery? And generally speaking, I rarely feel like there's any benefit in doing any kind of skin removal. I think that skin removal is overdone and a lot of people end up with rounded eyes. So I'm just straight off the bat, because we want to distinguish skin quality from skin quantity. And rarely is there a situation where there's truly a significant amount of excess skin under the eyes. There can be some relative redundancy because of deflation or loss of volume, but that's a very different scenario. So, that being said, the first line of treatment has always been to use some type of thermal energy device, typically a laser. For a lighter skinned person, there's a benefit of using a laser where such as the fractional CO2 laser, ablative CO2, fractional erbium, ablative erbium. And all of those modalities have their own special benefits. But the question that always came to mind for me was, how much capacity does the individual have to generate enough collagen and skin quality to make a significant difference? And that's where the balance became a challenge, is that the general tendency or the general expectation is the more aggressive you do a laser, the better your results will be. But when you follow a lot of people out over many years, and I've been doing lasers since the mid-90s, and when I looked at these patients who had had very aggressive treatments done elsewhere, who came to my practice who were still concerned about crepey skin, I realized that aggressive laser can't be the only modality. There is definitely a place for laser, and I do use laser pretty much consistently every time I do lower eyelid blepharoplasty in a lighter skinned person. But in addition, I use something called platelet-rich plasma. And the point of platelet-rich plasma is to encourage collagen formation, restoration of blood supply, and other elements from an intrinsic or under the skin approach with the laser. And in fact, after I do the laser, I also apply platelet-rich plasma to the skin surface to improve healing and encourage improvement in the rate of healing. So I would say that for crepey skin, you have the option, if you didn't have a laser at the time of surgery, or if you had something very light, you can consider laser, but I would also, in my practice, would recommend PRP. Now, if this person has darker skin, then usually laser is not the best option. Sometimes you can do a light erbium fractional laser for someone with darker skin, but generally I'll end up using some type of thermal energy device such as Pelleve, which is radiofrequency based, to help improve the skin quality through thermal modality, and I also combine that with PRP. Very often for either light skin or dark skin, PRP will also help the skin quality and improve the appearance of dark circles. Now, beyond that, I explain to my patients that once we reach a certain maximal benefit from the treatment, then we have to consider how to be proactive to maintain the skin and prevent or minimize the continual deterioration of the skin. And that's where a program of doing some PRP with some regularity or with consistency has some value. The use of some topicals also has some values, whether it's something in the retinol family or topical vitamin C and other topicals that benefit the skin. So when it comes to crepiness, you can't necessarily 100% get rid of it, but you can improve it. And you have to also think not only about a single procedure, but something for maintenance. There's a big distinction here. When you have lower eyelid blepharoplasty, I always tell my patients, once I take the fat pockets, you've got a long-term benefit from that. And it's unlikely that you'll ever get the same appearance or re-herniation of that same volume of fat. You may get small amounts of fat here and there. But when it comes to skin, skin requires some type of maintenance plan. And that's something where you have to have a good relationship and discussion with your doctor about that. So in summary, think about some type of thermal device for darker skin, radiofrequency, for lighter skin, laser, and for both, I also recommend platelet-rich plasma as well as topicals. So I hope that was helpful. I wish you the best of luck. Thank you for your question.